Eltrombopag, colon-stimulating factor, hematopoietic agent, thrombopoietin receptor agonist, used as first-line treatment in combination with standard immunosuppressive therapy of severe aplastic anemia in adult and pediatric patients more than or equals to 2 years of age, and used for the treatment of severe aplastic anemia in patients with an insufficient response to immunosuppressive therapy. And we should also notice that it is approved for the treatment of severe aplastic anemia in adults only, and used for the treatment of thrombocytopenia in patients with chronic hepatitis C, CHC, to allow the initiation and maintenance of interferon-based therapy. And we should also notice that it is approved for the treatment of CHC-associated thrombocytopenia anemia in adults only, and used for the treatment of thrombocytopenia in adult and pediatric patients more than or equals to 1 year of age or more than or equals to 6 years of age with persistent or chronic immune thrombocytopenia, ITP, who have had insufficient response to corticosteroids, immunoglobulins, or splenectomy. Unfortunately, for ITP, Eltrombopag should only be used if the degree of thrombocytopenia and the clinical condition increase the risk of bleeding. For CHC, Eltrombopag. Calcium-rich, more than 50 milligram foods decrease the absorption of Eltrombopag. Management administered on an empty stomach or with a low calcium, less than or equals to 50 milligram meal. Administer Eltrombopag at least 2 hours before and 4 hours after foods high in calcium. Eltrombopag is a thrombopoietin TPO non-peptide agonist, which increases platelet counts by binding to and activating the human TPO receptors, also known as CMBL, activates intracellular signal transduction pathways to increase proliferation and differentiation of megakaryocytes. Onset of action, platelet count increase within 1 to 2 weeks. Duration, platelets return to baseline 1 to 2 weeks after last dose. 99% protein binding, 52% at least bioavailability in adults. Plasma AUC was increased by 22 with the oral suspension versus tablets. Half-life elimination, 21 to 32 hours in healthy individuals, 26 to 35 hours in patients with ITP. FDA approval date is November 20, 2008.